Hello, everyone, and welcome to today's press conference. This is the Ontario Health Coalition's Day of Action on Long-Term Care. And today we'll have four speakers. We'll have Natalie Mehra, the Executive Director of the Ontario Health Coalition, Dr. Amit Arya, a palliative care physician in long-term care homes, Jane Meadus, a lawyer from the Advocacy Center of the Elderly, and we'll have Alessandra Presenza of Seniors Against For-Profit Care. And then afterwards, we will have an MP. We'll have some politicians be speaking as well, and then we'll follow up with a Q&A session where I will ask everyone to please put in the chat if you have a question. So indicate you have a question, indicate what your name and what your media station is, and then I will unmute you and you'll be able to ask your question during the Q&A portion. So first, I will hand it off over to the Ontario Health Coalition's Executive Director, Natalie Mehra. Natalie, please go ahead.
Sal, are you ready for me to go?
Yeah, go ahead. Go ahead.
Sorry, it's just very loud behind me. I don't know when you're ready for me to go. Please give me the thumbs up. Okay, thank you. Okay, thank you very much for being here today. I'm just standing in front of Queen's Park where we have a motorcade that is now encircling Queen's Park. This is one of 24 protests across Ontario being held by health coalitions, by families of residents who've died in long-term care as a result of COVID-19 and as a result of neglect and inadequate care. We're holding the protests because we've been waiting all summer for a plan from the Ford government to improve care and long-term care. And in the last week and a half, as the province announced funding and staffing for healthcare, we were just stunned that there really is no actual plan. There are piecemeal measures, there's some money, but unlike the Quebec government that acted 4 months ago to hire 10,000 PSWs and get them into the homes, last week started hiring a manager for every one of their 400 homes to pair with an infection control specialist and get them into the homes to stop the outbreaks. BC, which acted 6 months ago to give full-time work, improve the wages and stabilize the workforce in long-term care. In Ontario, just nothing like that has happened. And the staffing shortages, the staffing crisis in long-term care is now worse than it was prior to COVID-19. In the homes where we're seeing larger outbreaks emerge, the staffing crisis is just beyond words. They are describing in Ottawa at Extendicare's West End Villa, one PSW for 30 residents who are COVID positive. One PSW for 30 COVID positive residents. That would be impossible if the residents were healthy. That is just unspeakable. What we've seen in Ottawa, where the largest outbreaks are right now, is inadequate staffing, no intervention early enough to get the isolation happening in the home, family members describing rooms in which residents are wandering in and out of rooms where residents have COVID-19 and active symptoms, late testing, inadequate infection control, critical shortages of staffing, just all of this litany of problems that we saw in the first wave. And at this point, we would have expected to see some kind of plan from the province that when 1 or 2 people are infected and a very low threshold, that there would be immediate intervention, including ensuring that there's enough staffing, ensuring that the staff have PPE, that there's isolation, that the home gets tested, that if there is no adequate care in that home, that the residents get moved out of the home or staff get moved into the home, because the consequence of allowing people to die dehydrated, malnourished, alone, without adequate care in a pandemic in which they are suffering enormously is just unconscionable, and we can't let it happen again. So across Ontario today, we're holding protests. We're calling on the Ford government to get its act together now, get a plan, so that there's immediate intervention in long-term care and to improve the care and staffing levels to get them up to safe levels so that people can get adequate care. I'm going to turn it over now to Dr. Amit Arya. Dr. Arya is a member of the board of the Ontario Health Coalition. He's also a palliative care doctor who works in long-term care homes now in Ontario and has firsthand experience of the conditions. Thank you.
Yeah, thanks, Natalie. I also wanted to add that, I've actually been leading, my hospital's response as part of the COVID-19 sort of rapid action team. And I've seen firsthand the conditions in many of the outbreak homes, which are, as we all know, really appalling. And I really wanted to echo a lot of what, Natalie has already said. I mean, these homes were already in a crisis before COVID-19 with barely enough staff to make it through on a good day. Our province has the highest percentage of for-profit homes where we know that outcomes for residents are far worse. And what happened with COVID-19? It really exposed those gaps in the system, and it led to a crisis within a crisis. We're just looking at the patient ombudsman report this morning, which shows that in one home, they lost 2/3 of the staff. And I don't know how that would be allowed in any other healthcare setting, in a daycare or any other situation where people are vulnerable and need care. Through the summer, we had the Ontario Health Coalition survey, which showed that 95% of staff were reporting shortages. And why is staffing so critical? Well, the staff are the people who look after the residents, and low staffing numbers translates directly to neglect of residents. Not enough time to feed them, not enough time to get them water, not enough time to get people out of bed, and obviously opportunities for psychosocial care, emotional support are really non-existent. I mean, Natalie brought up that appalling incident that I even read to at Extended Care West Villa, where a single PSW was looking after 30 COVID positive residents. And our province, I would absolutely agree, has done nothing substantial to date to address the staffing crisis. I also wanted to talk about essential family caregivers who were locked out for 6 months during the first wave. And it was only after a big battle with the government, that was led by many advocates, that they were allowed back in. But this access is still precarious, as the government just put out a guidance document. There was no directive and nothing enforceable. Another thing that's come out is that many of these homes, which had large-scale COVID-19 outbreaks, had multiple complaints over many years. Inspections were actually rolled back by our current government before the pandemic. And I'm asking everyone on this call, all the media, what power do these inspectors actually have? Orchard Villa had 148 violations in 5 years. Extended Care West End Villa, which is the home that Natalie and I are speaking about, had ongoing inspections in July. So this really shows us that the system at this current time isn't good enough to protect the residents and their families. And let's keep in mind that while people were dying on the front lines, healthcare workers were double shifting, families were locked out of the homes, large for-profit corporations continued to pay out their shareholders, and maintain their shareholder dividend throughout the pandemic. In fact, some of these corporations have paid out over $100 million to their shareholders so far. So, how is that even acceptable? We need the government to act now and do everything in their power to recruit and hire staff. Even their own staffing report over the summer called for a PSW ratio of 1:8, which should immediately move to 1:6 after that. All the staff need to work in one home, need to have full-time work, sick leave, and a decent living wage. Advocates and experts have called for years to have 4 hours of direct hands-on care per resident. And why hasn't this happened? Essential family caregivers need to continue to have access into these homes, safe access. People deserve to see their loved ones and should not be spending their last months or years in solitary confinement. Seniors' lives should not just revolve around infection control. And we know from the first wave, the harms of social isolation are profound and real. I've seen those harms as a physician who works in these homes. And I really think the government should protect the rights of essential family caregivers under law.
Okay.
As Natalie mentioned, hospital and community-based medical teams must be on standby and ready to step in. They need to have a very low threshold of being allowed into long-term care homes with outbreaks. The moment there's any sort of issue with not enough staff, where people, once again, if there's not enough staff, that people's basic care needs, such as being bathed, getting food on time, getting water on time, are neglected, the team needs to be let in. And also there needs to be a plan to transfer residents to a third location, such as a hospital or another place subject to the right of consent.
Okay.
I would actually say that the inspection system needs to be changed immediately, where the inspections need to be unannounced, the results need to be made public, and any home which endangers the lives of the residents, should face harsh public penalty. We need to make sure that, in fact, we take away the license of any home permanently at that point, bringing it into the public system.
Okay.
And yeah, I just wanted to add one last point that, I really think that for-profit corporations should not be allowed to be taking profit at this time. They can end this crisis by ending their profits, and our taxpayer money should not be flowing to these big corporations, while they're still paying out their shareholders. I just wanted to end with one quote that stuck out for me. So earlier this week, when referring to restaurant owners, our premier said, and I'm quoting the premier, "I want to exhaust every single avenue before I ruin anyone's life." So where is this approach for our seniors and their families in long-term care? Why didn't we learn earlier during the summer? Why didn't we learn from the lessons of the first wave? Why didn't we learn from the military? And what will it take for our government to take action?
Thank you very much, Amit. And next we have Jane Meadus. She's a lawyer with the Advocacy Center for the Elderly, specializing in the long-term care sector and its issues. Thank you, Jane. You're on mute.
Thank you for having me. Over the course of the pandemic, our office has heard from hundreds of caregivers, family members, and residents about the poor conditions that have been going on in long-term care. I think Amit has spoken very eloquently about many of the issues that have arisen during the pandemic. And I agree that, we haven't seen the plans that we need to have in place. In fact, one of the I think the key findings of the patient ombudsman, and I'm going to quote it, it says, "However, many of the key public health risks remain the same for a second wave, and Ontarians should not expect a different result under the same conditions." And we agree with that. We had the pandemic in the spring was very devastating. It eased up a little bit in the summer, and yet we saw no real substantial changes, no plans in place so that the homes would be prepared. We're still seeing hospitals having to take over homes because they're not prepared for infection control. This should not have to happen. It is very clear that long-term care homes have always been susceptible to any kind of infectious diseases, and yet we have not prepared them, and we don't have the staffing, we don't have the training in those homes. And when you only have one nurse and no doctor on staff at any time, so the doctors come and go, how can you have a proper infectious disease plan? Visitors are key to long-term care homes. We're already seeing a pullback in the quote hotspots of visitors in long-term care. This is going to have continued devastating effects on the residents in long-term care homes. They cannot continue to have lack of social contact. The other thing that is happening is that residents are continued to be refused to being allowed to leave homes. This has been a problem ongoing. We have actually detained 72,000 people in Ontario through directives, which I do not think the Chief Medical Officer of Health has the authority to do that in these directives. We have thousands and thousands more retirement home residents who have been detained, many in areas that didn't have any COVID outbreaks. We have a society where liberty is important, and that's not to say that infection control isn't important, but we have to ensure that we are not focusing on the infection and leaving all of the other social and emotional issues for residents outside. So I have a client who presently is in a situation where they were very happy to finally get out of the home and be able to go. And now because they're in a hotspot, the home is now again preventing them from leaving. And this will be devastating to the emotional well-being of many, many residents who we hear have been devastated by the social isolation, really what has been solitary confinement into homes. And again, the lack of ongoing care, lack of baths, homes that have very, very poor food. They're not feeding the residents. So many of the residents who don't have COVID, they may have dementia, they may not be eating very much, they may not be get fed properly. And if the food quality is very poor, which is what we're hearing, they're not going to want to eat. And I think that we are having many deaths, many people are dying or becoming very ill, not from COVID, but because of the socialization and the poor care that is going on in those homes. Thank you very much, and I'll turn it over to the next speaker.
Thank you very much, Jane. And next we have Alessandro Presencia. And Alessandro, both of his parents died in long-term care homes recently, and he has organized a group of families of people who have had family members in long-term care. They now represent about 1,000 or so families. And Alessandro, can you hear me, and are you able to get on? I don't know if he's able to get on. If not, I'm just going to move on very quickly. We asked, part of the goal today is to really to ask for, because every day the Ford government has had a press conference all through the spring, all through the summer, and they've repeatedly promised to do something about long-term care. They've made all of the right noises, sounded sympathetic, but the truth is that even we are completely astounded at how little has actually happened to improve the care and the conditions in the homes. In fact, we're extremely worried, and that's why we've gone to the extent of calling for a day of action in the middle of, you know, a sweeping second wave. At this point now, about 50 long-term care homes have outbreaks, some of them getting quite large, particularly in Toronto and Ottawa, and another 40 or so retirement homes have outbreaks now. So we're looking at about 90 outbreaks, and the size of them is growing across the province. We really are in a second wave, and you know, things needed to happen months ago and they haven't, but they absolutely have to happen now because people are dying. I mean, in Extended Care's West End Villa now, there's 123 people that have been infected, and that 19 have died in that outbreak. So we're asking all of the political parties to make this a priority, to raise this in the House. There are issues, in addition to whether you can go to a restaurant or a bar, you know, how many people at the Thanksgiving table. The total lack of a plan in long-term care has not gotten the coverage that we think it deserves. And so thank you for being here, all of you. And we asked John Fraser, the Liberal health critic, and John Vanthof, the deputy leader of the NDP, to come and bring a brief statement about what they're doing and what they're hearing, just briefly, and then we'll open it to questions and answers. So I'll start with, just from my screen, John Fraser, Liberal health critic, former leader.
Thank you very much, Natalie. Thank you very much for inviting me here today. You can hear me, I can see, which is great. It's really hard to understand how we find ourselves at this point right now, at the beginning of this second wave, so unprepared for COVID-19 in long-term care homes and in our community. So we didn't learn from our mistakes at the beginning or the lessons at the beginning of this pandemic. And the biggest lesson was you needed to act quickly and decisively. And this summer, the government took its eye off the ball. It needed to do what Quebec and BC were doing, which was aggressively hiring and training thousands of PSWs. They needed a workforce. That didn't happen. The people who run the homes, the residents, the staff, were pleading for a plan all the way through the summer. We saw one come about a week and a bit ago. That's just not good enough. And in my hometown, there are 12 outbreaks. That's almost 1/4 of all the outbreaks in Ontario. We've got West End Villa, where tragically 19 people have died, 123, 130 people are infected. It's just unbelievable how we got here. And so there are two things. You know, first of all, most importantly, it's what are we going to do right now? The government immediately has to act to ensure that there's enough staff in these homes. That's either aggressively hiring or aggressively working inside communities to find the staff that they need and have them exclusive to those homes. not have agency staff going back and forth like they are in Ottawa right now, which we all know is not good and will spread the disease. Infection control is very important. The government has to take stronger action. The homes have been asking for that. And my last point is a really important point, and Dr. Arya brought this up, and so did Jane. Essential caregivers. We saw a pandemic of loneliness where people were unable to thrive because they didn't have the most basic human need, which is connection and contact, that you're there and that it matters. And if we don't act aggressively right now to ensure that essential caregivers can get into homes, even where there are outbreaks, the same thing is going to happen. And the stories that we heard from the patient ombudsman and the stories that we're hearing from the commission are all going to happen again.
Okay.
The government needs to act. Thank you.
Thank you very much, John. And thank you also, John Vanthof, Deputy Leader of the NDP, for being here. Go ahead, please.
And thank you for inviting us, and thank you for bringing attention to this issue. As Deputy Leader of the Official Opposition, our leader and our health critic, Fanal Jelena, have been pushing this issue relentlessly. And the crisis in long-term care homes has been there a long time, previous to the Ford government. The COVID has shone a bright light on it, and I'm sorry that Alessandro couldn't connect, because I lost my mom in March in a long-term care home, but I was fortunate enough that because she was dying, they let me in. The rules still, so I could be with her when she died. I can't imagine what families have gone through. But I know PSWs who don't work in the industry. My wife is a waitress in a restaurant in Northern Ontario, and there are PSWs who work with her because you have better hours and a higher income working in a small town restaurant. That is a huge part of our problem. We need to ensure that we don't just have little programs, or I'm not knocking the emergency pandemic pay, but that's not what we need to fix this. One of the things we need is PSWs, people, and other people who work in our system who have the compassion to do those jobs, who want to do those jobs. They have to be made into careers with full-time employment, with benefits, with security. Those are the people who take care of our most vulnerable. And I watched when my mom, she was in extended care for 3 years. It was a well-run home, I thought. And one day I job shadowed one of the PSWs, and this was pre-COVID. This was in November. It was impossible to do the work that needed to be done.
Okay.
So there's all kinds of things we have to fix, but no more Band-Aid.
Uh-oh.
Job security, well paid, paid what they're worth. Thank you very much.
Thank you very much. And thank you for being here. I understand that you're heading into question period fairly soon. And so if you need to step off, we understand, and thank you.
I appreciate
Sala,
that.
please go ahead, and we'll just open it up to questions and answers. And hopefully if Alessandro is here, we can direct some questions his way. Not sure if he can hear us.
Okay, well, now we enter the Q&A portion of the press conference. So if any members of the media have any questions, please indicate in the chat that you have a question. Let us know your name and your publication, and then you'll be asked to unmute. And when you ask your questions, please feel free to direct it to any one of the speakers. So if anyone has any questions, please indicate in the chat. So Jessica Smith from QP Briefing, please unmute and go ahead and ask your question.
Hi, thanks so much for taking my question. Earlier this week, Minister Fullerton, I asked her about the 4 hours of hands-on care, and she said that that is a goal, but she said that there isn't currently enough staff to make it a reality. And I was hoping to get, well, basically everybody's comments on what she said.
Okay, so I'll just, I'll direct that towards, I'll just take the question about whether there's enough staff. The truth is that we did roundtables across the province on the PSW crisis and long-term care, and over the last 2 years, so about from 2017 on, we started hearing of really critical PSW shortages. So even according to the staffing plans for the homes themselves, which we know are inadequate, they couldn't even fill those shifts starting around 2017. And we asked where the staff had gone. And, you know, as John Vanthof described, they'd gone to restaurants, they'd gone to school boards that hire PSWs because the wages and working conditions were better and so on. So there are PSWs in Ontario. The truth is that our government has not done what Quebec's government has done and what BC's government has done to provide full-time work, to pay people for training. I mean, Quebec has, I think, the best model. They have gone out with the full weight and power of government behind it and recruited 10,000 new PSWs. They've trained them. They're paying them $21 an hour for training, $26 an hour to stabilize the workforce, understanding that there's no care without workers. And in Ontario, we're short PSWs, we're short nurses, we're short cleaners in the homes, laundry, you know, a range of workers. The ministry is best placed to actually ascertain what the goal should be and go out and get it. But the truth is they're just not doing that work. All of the measures have been piecemeal, you know, little pockets of funding for training, you know, a web portal, no major recruitment strategy, just nothing like what we've seen in Quebec and BC. So, you know, I just think that's a cop-out.
I guess to follow up, and this is to anybody who would like to weigh in, perhaps Jane, you would as well, is a goal good enough? And how quickly could this be mandated and in a way that it's possible for the homes to comply?
Amit and John, do you want to try that?
Yeah, I mean, I can answer. I just wanted to echo what Natalie was saying is that, I mean, we should have acted much earlier. But of course, every day matters. Every day of inaction matters, and every day of action would also matter. So we need to really make sure that the changes are not just coordinated, as Natalie has mentioned, but are permanent. I was really shocked by their sort of wage incentive, where they are paying sort of PSWs $5,000 after they complete 6 months. And the question we have to ask ourselves is, what happens after 6 months? I mean, as Natalie has alluded to, and as the NDP MPP who is here, the deputy leader already alluded to, the PSWs unfortunately have a very high rate of attrition. Many of them are leaving the workforce, and this was happening before COVID. And there's this revolving door of health workers, which is actually the opposite of what we need. So we don't need temporary solutions. We need permanent solutions to this problem.
John, did you want to add anything?
Yeah, I'll just, I might, you can hear me okay, I'm not on mute anymore. Yeah, look, just simply a goal isn't really meaningful unless you have a plan to get there. And the government has not had a plan even to address what we need to do just for the pandemic. So what the government needed to do was what BC and Quebec did, which was aggressively hire people and train them. And as a matter of fact, there was a program for foreign trained nurses to work as PSWs inside the ministry that somehow fizzled last spring. So, you know, there's, in our acute hospitals, we had an all hands on deck approach at the beginning of this pandemic. In long-term care, that hasn't happened, and it's not happening right now. And, you know, we're in a second wave. There's likely going to be a third wave. So the government needs to be acting aggressively right now. And it's just not happening. It's hard to understand why.
Thank you very much, John, and thank you very much, Jessica, for your question. If anyone else has any questions, please feel free to indicate in the chat if they have a question.
PJ Wilson does.
Oh, PJ, okay. PJ, go ahead.
Hey, sorry, it took me a bit to unmute it. I was just wondering, how many PSWs are needed in the province, and how soon could they be put in the long-term care homes?
Jane, do you have a sense of that? I don't want to put you on the spot because I don't think anyone has a number exactly.
Yeah, it's hard to know. You know, there are studies certainly that would indicate, you know, how many, you know, staff are needed. And I think that information is available there. you know, it could have been done quicker than it is. There are different types of programs, different kinds of training programs that are available, including ones that could be put into homes where people might do training in the home. You know, the government has control over how the training for long-term care takes place. It's in the legislation. So they do have that control. And, you know, they really missed the boat in not getting people trained over the summer. We knew that not only were there not enough PSWs, but the kind of band-aid solutions that were occurring, such as nursing students coming in as PSWs, educational staff that were coming in, were going to be lost in September, just when the second wave was going to hit. And so while in the beginning, when people had been sort of laid off or weren't going to school, you know, things were shut down, those people were able to go into long-term care. Those people have disappeared. I think the other thing that is really important to understand is that this system has always been underfunded. It is not looked at as being an important part of our healthcare system. We're still seeing that with, you know, everything is to the hospitals again, even though 2,000 people almost died, and we may be up to that number now, I don't know. In long-term care, we're up to 2,000. And despite that, still we're throwing the money and the effort into the hospitals. And there's a real discrimination against people. This is why people, you know, this was one of the issues we looked at the Galeese inquiry, because Elizabeth Wettlaufer was able to work in long-term care homes, not because she was a great nurse, but because they needed a warm body. And we have to really make sure that long-term care is a place where people want to work in general, and that they're going to have that fulfilling career that we've heard about. And that is just not happening. So I think that the government had to act. I mean, they have to act now. If we don't have enough PSWs, we have to train them now.
Yeah. So
I just wanted to add two sentences.
Sorry.
Yeah, just 2 sentences, I promise. So basically, it also speaks to how in this sector, we don't have a legislated staffing standard. Yeah. We don't have legislation around this, and we don't have transparency, where you don't know what's going on behind those walls. Is there one PSW for 6? Is there one for 20? Is there one for 30? And we need to change that system where there is complete transparency, a legislated ratio, and 4 hours of hands-on care and accountability for that.
And just on a more direct answer to your question, PJ, in Quebec, they aim to hire 10,000 what they call orderlies, or the equivalent of our PSWs. And their staffing situation, by all of the accounts of the, you know, Health Coalition and public interest voices, was, you know, a bit better than ours. So if they needed 10,000, they have got 400 homes. We have 626 homes. You know, we're looking at numbers akin to theirs. I think the other piece to note is that, like, there's high turnover in management, and there's a real management quality issue in the homes here as well. That has, I think it's evident to all of us and all of you from what's happened in the pandemic. And the fact that Quebec has moved to deal with the management issues in a way that Ontario really just hasn't. I mean, no one's lost licenses. You know, the family groups are putting out all over Facebook that you face a bigger penalty for having a party than you do for, you know, negligence that results in death of 80 plus residents in your long-term care home in Ontario. That is the truth. And that, I think, people find shocking and appalling, and they're very angry and upset about, and rightfully so. You know, we need to deal with the incompetent and the negligent managements in Ontario as well. And get, you know, management into the home, infection control into the homes. What the government announced in its kind of piecemeal funding announcement was 150 infection control people. There's 630 approximately homes, so that's not even one per home. That, just to put in context what's happening.
So Natalie, if I can just chip in really quickly, it's between 10 and 15,000. And the reason that we have to aggressively hire them is right now during this pandemic, every time one PSW is off, that affects anywhere from 10 to 20, we heard 30 in this case, residents. So we need to be able to replace them right now. That's why they had to do this aggressively. And then when we come through this, that's going to help us get to the goal that we need to. Right now, it's just, we need replacements. And the government hasn't, the 2,000 that they announced, that's 3 per home. 3 PSWs for each one of the 626 homes.
For 6 months.
for 6 months. Not going to do it.
Once they graduate. Yeah.
Yeah.
Okay, thank you. Any other questions? Sorry, we promise we won't pile on like that. Are we good?
Perfect.
Okay, well, thank you very, very much for joining us for this. We know you really care about this and have really reported a lot on this issue, and please know we really appreciate you doing that, and it's so important to so many people. So thank you. Have a good day.